Okay, well, everybody would like to welcome you here to this week. This is a follow-up to last week where Corey uh, sort of introduced us to some of the opportunities with Select Health, and she is going to be digging in more detail into that this week. And we think there's a great opportunity out there, but to take advantage of the opportunities, we have to understand the industry in a little bit different way than we have traditionally understood it. So anyway, would like to encourage you all, if you have questions, to ask those questions. Nancy will be monitoring the chat. I'll be monitoring the chat as soon as I get back. And Corey, take it away.
Okay, thanks, Doug. So myself, Corey Moyes, Kirk Brown is on, and Grayson Howard, we are part of your Select Health sales team and support for Medicare Advantage plans in Utah. And we just really appreciate the opportunity to be on this call with you again, for those of you that were with us last week, and really introduce strategies of how you can maybe think outside the box or utilize Stonehill's network of partners and commercial brokers to continue to get referrals and grow your business and create a really amazing business within the Stonehill family. So I'm gonna do my best here to see if I can figure out how to share my screen again. There we go. Can you guys see that? Oh, there we go. Might have figured it out this time. Perfect. Can you guys see that?
We can.
Yes. Great. All right. So welcome. Thank you for being here. If you're here, it's because you probably are interested in learning how to grow your book of business within the Stonehill family. Let's see if I can get this to slide over. Nope. Hang tight. There we go. What we're really working on is a strategy for cross-selling over and really training you to be the Medicare advisor to a large, mid-size, or small group employer. That's why we're here. We're here for strategic alignment. You may or may not know, we talked about some of these things last week, so we're going to do a little bit of a recap, some introduction, and then we'll open it up for Q&A at the end. So if you have questions kind of in the middle of presenting, feel free to pop them in the chat, but we will open it up for Q&A towards the end of our time together today. Select Health is one of the largest commercial carriers in the state of Utah. We have a strong presence in Idaho and Nevada as well. And so we as a carrier are looking for ways to continue to crosswalk over our commercial lines of business, so pre-65, over into our Medicare Advantage plans. And you'll see that this is an initiative that all carriers are having right now, who are selling in both spaces. So we're talking about growth and retention initiatives. We want to grow, we want to retain business. Stonehill wants to grow and retain business and continue to provide a lot of value to you as their broker partners. And so we're talking about partnership. We're talking about an opportunity to get you merged with or set up with an in-house Stonehill commercial broker who might have plans with Select Health right now, where you can come in and be that Medicare advisor. And then we're going to go over some of the implementation strategies that we would recommend so that we can start to teach how you do this. How do you go in and present to a group? A lot of you are used to doing one-on-one sales for Medicare. When you're presenting to a group, it's a little bit different. You have to understand that they're coming from a very different model of healthcare and insurance plan. And so we want to be able to speak to their needs and teach you how to do that. So we want you to know that you have a unique role as a Medicare advisor in the employer space. We talked last week about how, CMS really regulates what can be talked about from the group perspective or from an HR director perspective. They're really limited. They cannot encourage Medicare age members to move off of a group plan onto a Medicare Advantage plan. They can't entice or encourage them to. And there's even limitations on the commercial side from what a broker can say. So that's where you can come in and be that strong voice and Medicare advocate and really provide an education, a plan and cost comparison, full risk analysis. What are the premiums? What are your drugs? What's your spend for medical every year? And really do a deep dive and advise a member on all of their options. You as a Medicare advisor actually can do that. And what this can result in is a really strong strategic partnership between a group, a commercial broker, and you as the Medicare advisor. You can help them save money on the group side. And oftentimes it's a really good fit for somebody who's Medicare eligible, who might still be working or have partners on a plan with them, to move over to a Medicare plan and saving them quite a bit of money. So last week we had a question come up about HRAs and how they work. So I'm giving you a little bit of a snapshot here. One of the things we talked about last week is that health savings accounts, if you've got a high deductible health plan on the commercial side, once you qualify for Part A, you actually can no longer contribute to an HSA account on the commercial side. Even if it's available to you, you cannot continue to get the tax benefits of an HSA separate account. And so you as a Medicare advisor need to understand and know this. If you've got a group that's offering an HRA account, which is a health reimbursement account, that actually does work hand in hand with a Medicare eligible member. So I just gave you a little bit of information. There's a ton of information out there, and I can share a link out with the group if you want to dive into this further. But some of the questions: who owns the plan? With a health savings account, the member owns the plan. It's an elective contribution into a separate account. With an HRA, the health plan actually manages the plan. Who funds it? With an HSA, like we talked about, when you become eligible for Part A, you can't contribute to an HSA anymore. With an HRA, the health plan actually is crediting premiums in, and you as the member or the employee cannot contribute. So there's no employee contribution in an HRA plan. It's something that the plan actually, or the employer actually contributes to. One of the questions that often is asked, is there a balance forfeiture? Like, does it roll over year? Yes, it rolls over every single year. So you're not forfeiting anything in an HSA because you own it. You're not forfeiting anything on an HRA when you retire. It really has to do with if you terminate your employment or you have changes in your health plan. So if you're of retirement age and you continue to work, you can continue to receive the contribution for an HRA. You only forfeit that because it's an employer contribution when you leave or change plans. Medicare eligibility, we've talked about it before. HSA is no. HRAs are available to members who are on a high deductible health plan who are not currently eligible for an HSA. So I will send out the link to you guys. Doug, I'll shoot that over to you. Maybe you can shoot it out to this group. But it's a really amazing grid that a company came up with that shows all the differences between HRA and HSA. They're not tax deductible. There's a lot of different features that you just should know the differences, because more and more we're seeing a movement to HRA contributions instead of HSA contributions from large employers and mid-size. So I wanted to touch on that and answer that question. Are they compatible? Are HRAs compatible with Medicare? Yes, they are. And in fact, you can use HRA premiums to actually pay for your Medicare premiums, which is something you cannot do on an HSA. So just some interesting features, and I can send you out again more details. We wanted to touch bases today and talk about what is Select Health doing. So for those of you that aren't selling commercial plans with us currently and strictly working in Medicare, one of the things that Select Health is doing on the commercial side, we have multiple networks. On a Medicare Advantage side, we have one. Why is that? We have different networks and different reimbursement rates. They're completely separate contracts. So commercial reimbursement rate for services is one contract. Medicare reimbursement rate is a completely different contract. So what happens to a Medicare member who's on a group plan and all of a sudden they age into Medicare? They may have a different network completely because doctors and facilities have decided that they're going to contract with one or the other and not both. One of the benefits of moving to a Medicare Advantage plan with Select Health is that on the commercial side, University of Utah is not in network except for urgent and emergent care and very specific services. When you move over to the Medicare Advantage network, you actually have access to all U of U providers, facilities, their entire network. So your network actually expands with the Medicare Advantage plan. So I want to make you aware of that. This is an initiative that Select Health is looking at right now. How do we streamline those networks so that somebody on the commercial side has a seamless progression over to that Medicare side? So you're going to see some changes start to come over the next couple of years. with our networks, but I wanted you to understand the difference of why. It's because the reimbursement rates are different based on commercial or Medicare contracts. The other thing that you might find, if you are a Select Health member on a group plan, you're going to be used to hearing about Connect Care. That's our virtual telehealth visit. You're going to have that seamless integration over onto a Medicare Advantage plan. If you've got somebody using that benefit, they're going to crosswalk right over into a Medicare Advantage plan and still have access to that. The other thing you might find is on a commercial plan, a lot of times you're paying premiums for a dental or vision. On the commercial side, when you move over to a Medicare Advantage plan with Select Health, you get first dollar dental benefits built into your plan and a vision benefit included. So these are some of the things you're going to want to talk about when you're doing a side-by-side comparison. Papa Pals, which is a companionship service that Select Health offers on their Medicare Advantage plan. That's not something that's offered on our commercial side. So they can have somebody come in and help them with light chores, take them places, help them with technology. We have a really amazing medication management. For those of you that are really familiar with our Select Health product, we have Intermountain Health Home Health Delivery, RX Saving Solutions. There's a lot of additional support for our Medicare population that they're not currently getting on the commercial side. So some of those different changes. And then we have a very progressive formulary. Last week, we talked about how Select Health has formulated a company called Civica. They're one of the national healthcare chains, Intermountain Healthcare, that has created this Civica. We have our own pharmacy benefit manager. We've reduced copays on a lot of our tier 1 and 2 generics. 3.5 years ago, we moved over 300 medications into tier 1 and 2. So we're really looking at that senior population and saying, hey, how can we give you access to what you need at a more affordable price? So understanding those formulary differences are going to be really important. That's one of the primary concerns with the Medicare age population as they're aging in or even considering moving off a group plan. On the group side, most of them have never even had to make a decision about their health plan. Then all of a sudden they're getting bombarded with all of this information. And so we want to educate you and give you that opportunity to be that trusted advisor to them. All right, I'm going to turn it over to Kirk now, and he's going to be presenting some of our benefits that we reviewed last week. Just a quick snapshot for you as a review.
Awesome. Thank you, Corey. She's the best, right? So we all know the saying, repetition is the mother of all learning. So we wanted to just go over some of the key benefits and differences that the members will get as they start transitioning over from that commercial plan into the Medicare plan. And the first one here is the Connect Care. Now, they do have access to this on the commercial side, but I think it's definitely worth noting, and it's an underutilized benefit, especially as you get into that Medicare age range. This benefit can be used in a ton of different applications too, as they're traveling. But like today is a great example of an opportunity to utilize this benefit. If it's extra snowy and they don't want to go out, or they can jump on, get a call if they're feeling sick, connect with a doctor and get some medication for any of their needs. So a phenomenal benefit, super helpful for the Medicare aged folks. Let's see here. Can you go to the next one for me? Perfect. Okay, the Flex Card. So the Flex Card is our way that we distribute some of the benefits of our program. It's a reloadable debit card, but I really feel like it should be talked about as more of a gift card, a credit card, because some of the times it gets the issue come when people are trying to run it as a debit card. So make sure when you're talking to members about this that you tell them to run it as a credit. But it has 3 separate benefits all on the same card. It'll have the Wellness Your Way program, which is our program to encourage a healthy lifestyle. And really they can tailor that to what fits them best. And then the over-the-counter benefits, those are loaded onto the card each quarter, and then it allows the members to go and utilize the card to buy some of their over-the-counter needs at any of their favorite stores. And then the Healthy Living, that's the side of the program where as they go out and they do their activities to maintain their health, which I'll touch on in just a second. It actually goes and pays them money that gets automatically loaded onto the card. And they'll get this card prior to their effective date, whenever that is throughout the year. So as you're looking at the Wellness Your Way program, really this is just a snapshot of and a sampling of some of the things that our members can use this benefit for. And there's a wide range. It's not limited to this, but we realize that everybody isn't out golfing or skiing. And so as you look at this list, this snapshot, they can utilize it with a gym membership or, some aquatic aerobics or whatever the member feels that is an opportunity to maintain health and a lifestyle. That might be a nutritional program or a weight loss program. So this benefit is available to the members the first day of their annual enrollment or renewal. Most of it is $240. There are some plans that have a higher $480 benefit, but they can use that full amount the first day. So if they wanted to utilize it as a gym membership, pay for the whole thing, they can utilize it that way. And then the healthy living, this is, as they go throughout the year, traditionally, a lot of the things are covered anyways, even on a commercial plan. But when you're switching over to an MA plan, when they complete these activities, they're actually going to get paid for it. So that would include things like an annual physical, the flu shot, the health risk assessment, eye exam, those things that they are going to go out and do as they accomplish those or complete them. It's automatically tracked through their insurance as those things come through, and then it then loads straight onto their Flex card for them. They don't have to do anything. They don't have to submit any reimbursements or anything like that. It just automatically gets tracked, put on their card, and that money they use for whatever they want. I mean, groceries, gas, that portion of that card can be utilized any way that they want. So those are just a couple quick differences. Corey touched on some of the others that we'd love to go into more detail with you as needed, but like dental and Papa Pals, these are all things that have pretty big differences when you're comparing a commercial plan to an MA plan. That is, as we do side-by-side comparisons with you, will show a high value in transitioning from the commercial to the MA. So I think we're going to switch over to Grayson now.
Yeah. Hey, how's everybody doing? So we are a 5-star plan again this year. Everybody knows that. This is the second year in a row. I think last week we went over, and I apologize I wasn't available. But we went over what the 5-star plans mean. Obviously, if you're switching from commercial to MA, you don't necessarily need to use a 5-star SEP, but your member would be enrolling into a 5-star plan, which is a big deal. We're the only one in the state, at least northern Utah, that has a 5-star plan. Like I said, second year in a row. First time it ever happened in Utah was Select Health with 5-star. So that's a big deal. But I do want to reiterate, 5-star plans allows you, like now the SEP or now the AEP and OEP are ending. The big deal would be 5-star. You can enroll in 5-star plans throughout the year. Really, the only caveat to enroll in a 5-star plan is just having Part A and B. So they can come from another carrier. They can come from Original Medicare. They can come from if they've lost their insurance or if they've lost their Medicare plan or disenrolled in another plan. So anybody can enroll in a 5-star Medicare plan as long as they have A and B. That's That's really the only two things that qualify. The only time you cannot is when you come from another 5-star plan, which wouldn't be the case here in Northern Utah, Nevada, or Idaho. There is a 5-star plan in Southern Utah that United has, but that would be the only time. And also a reminder, our HMO plan is 5-star. The PPO plan is not a 5-star plan yet. It's too new, but all of our HMO plans across all 3 states you can enroll in throughout the year. So April, June, July, August, September, October, all they need is part A and B to enroll in a 5-star plan. This is a big deal. We're pumped to have it. This should be a big deal for you. You're going to get calls from members that says, hey, this is my situation. What do I do? Most of the time you don't have anything that you can help them out with, but the 5-star plan allows you to get that member on a MA plan starting the next month, the first of the next month. So let's go to the next slide. As we all know, the potential earnings, we went through this last week, but we just, as Kirk said, repetition is the biggest key to learning. And the reason why we do this is I know just this last week, we had 5 people call and say, what do I do? And we say, hey, remember, we're a 5-star plan. And so applying that, and those are agents that have quite a bit of enrollments with us. People call and forget that we have that opportunity. But I do want to touch base on this. So this is if you enrolled 5 new Medicare members to us from turning 65 or new to Medicare, and the potential earnings. So you would have the commissions of the $3,004.80, and then we are doing the marketing reimbursement or the agent administrative expense reimbursement, and you get $100 per plan once you get 5 enrollments with us. That's paid out quarterly, so you won't see it every month, but any plans you did from January 1st to March 1st, you'll see on your April 15th payout. If you got 5 enrollments, then you'll get your $500, and then it's $100 for everyone on top of that. And then if you complete HRAs on all those plans, that's an extra $275. So $55 a policy, with a total compensation of $3,779.80. So that's just the initial. Obviously, starting January 1 the next year, if you keep those 5 with us, you're going to have the monthly payouts on those, which is $25 and change. And so we are the highest paying out MA plan for a T65 right now due to the marketing reimbursement if you hit your 5. So just a reminder, there's a lot of money when you bring over commercial to MA or even from anybody else, but in this time we're talking commercial to MA. So there is incentive, money incentive for you to do that, and the compensation is very good. So next slide. So the next steps, what do? We've talked about these commercial partnerships. So we need to get with Stonehill. So your next steps are, if you're wanting to really work with the commercial agents and be able to either your own commercial members, or if you don't have any, get with Doug with Stonehill, and they're going to vet the process. They're going to figure out what agents that they want to work with in this program. Doug, do you want to step in and talk about that real quick, about the vetting process that you're doing, or is that something you want to talk about later?
We're going to talk about that later. We still have
Okay.
a number of things to do first. Thanks.
Okay. So, but that is the next step. Reach out to Doug if you're interested in participating in this program. Once you're good to go, we're going to get with you and do some strategy. We're going to whiteboard it. We're going to show you the processes. We're going to walk you through whatever you need to do to help this relationship with the commercial side of if it's your own agency, or if you get connected with another agency, if you've formed relationships with other agents. We'll create an introduction to groups and HR department heads. That's that's what you'll want to do as well. We won't create those. That's what you'll want to create. An introduction to Medicare eligibles. That's an agent and employees. Offer a plan review audit and a Medicare 101. So help to set up, if you want to set up to give a Medicare 101 and a presentation, we'll look at it for you. We'll help you set up one so that when you're given the Medicare 101s, it will go smoothly for you. And then we will provide CMS approved trainings for you as well if you want that. And so those would initially be the first steps. So anybody that wants to participate, I would reach out to Doug, and then we can go on to the next slide as well. Also, with these, so think about it in the commercial space, right? So you're working on your own commercial, or you're getting paired up, or you're meeting with commercial agents that don't sell Medicare. Think about using this process with everybody else. So go through your circle of influence, or who do you know, your people. How many life producers do you know that aren't selling Medicare? I mean, that's a huge potential to be able to get your Medicare book to grow that way. How many PNC brokers do you work with? I know I come from a PNC background. Agents do not want to get into Medicare. It's scary. They feel like they've been told, oh, that's the last place you want to get into insurance. And we all know this is the secret sauce in insurance. I would rather be in Medicare than PNC by far, but the PNC brokers don't know that. So get with them, form that relationship, and we can help you set up meetings or go to meetings, or how you would do a presentation with PNC brokers on crosswalking their book of business to be able to let them know. And there's referral programs that you can do, like we talked about with commercial agents. Community partnerships. How many community programs are out there? How many cities are doing financial programs where they're giving presentations on financial? Can you get in and do a Medicare 101? Can you give them the basics of insurance? Because a lot of people are just trying to find ways to learn about this. And everybody knows this, but it's just a reminder of these are other people that you could take what we're going to do with this commercial agents, and you can apply it to them. Your financial planning partners, the people that are working. I've also heard of people getting with funeral services, going to the funeral homes, because a lot of times they'll have end of life planning, and Medicare can be a part of that, right? And so just your circle of influence, how are you going to use that? How are you going to take this that you're going to work with these commercial agents and apply that to other aspects and other people that you know that can copy what we're doing with this? So, and then we'll go to next slide. So once again, referral fees. A common way to build a referral pipeline is through the implementation of referral fee. So sometimes agents give $100 per enrollment to a commercial agent, a PNC agent, a financial advisor, and that's completely legal to do. $100 per enrolled member in an MA plan, less for a standalone PDP or a supplement plan. So that's a way to incentivize people to work with you, because no one wants to do anything for free, right? Unless you have someone that is a gold mine that's like, oh, I'll just take my book of business and work it. But it really incentivizes them if you're going to give them a referral fee for anybody that you sign up. So I think there's a lot of opportunity out there, and we're here to assist you with this, and so is Stonehill. And like I said, the biggest next step, if you really want to participate, get in touch with Doug, and we'll facilitate all this with you, and be there to help you along the way. And so for the last half hour, we want to open up to questions. So Corey, me, and Kirk will be here. Doug, Bob, we're all here to answer questions, and Jeff as well. So
real quick question here. Pairing with a PNC agency or a life insurance agent or a financial planner or someone like that, can we initiate a contact to their clients because they have the other financial relationship. And if we say we're representing XYZ agency or something, can we initiate that contact, or do we still have to wait for them to call us?
You would have to do it. So this is just an example of what I would do. I would go into your, say you have a PNC agent buddy, right? I would go say, hey, can we work together? I have a referral that I give out to anybody that refer to me. I'm going to provide you an email or a template. That way they don't have to do the work, because they don't want to do any extra work, right? So you provide them the template and say, will you email us out to all your members? And that's the way that they're reaching out. But you've basically come up with the subject, the template, but it's coming from him to his members.
Okay.
I don't think technically you wouldn't be able to reach out. It would have to come from him, but that's the way that I would do it. I would just make it easy for them, provide everything, and you're providing him an incentive to do it. And then I would say, hey, if I'm not doing, if this isn't coming from you and we're not working together, they're getting attacked from other areas in the insurance world. There could be a PNC agent that's doing it, and they go, if they get their Medicare, soon they're going to get their PNC.
Right.
If he knows you, he's going to be comfortable with you working with their book and being their Medicare agents, because you're not going to take their PNC stuff, because you don't do that, right? So
just in that email or whatever, invite them to reach out back to me and go from there.
Yeah, however you guys work it out. But I would provide the template to them and say, hey, all you have to do is just send this out to your everybody that's over 65 in your book, or 60 and older. Just say, hey, and he can even say, I have someone that does Medicare. If you're interested, reach out to him. And then, so however you guys work it out that way. But that's just an easy.
Okay.
But I don't think you can reach out to his members. I would have him do it. And I think you want him to do it, because they know him. They don't know you, right?
Right.
So that's how I would do that.
Okay.
That's
cool.
exactly. So because they own the relationship, they actually can reach out to the member and introduce a new offering, because they already have that established relationship, and then they can invite them into contact with you. So if you've got somebody, or you need help formulating an email like that, reach out to us, reach out to somebody within Stonehill. We can help formulate those. We do strategy meetings like this all the time.
And Craig, so as you and I were talking just yesterday, transparency and building the trust between the group producing agent and the Medicare agent are critical.
Yes, I agree. Yeah, good. Thank you.
Can I pick up on something that Grayson talked about a little earlier, as far as next steps are concerned? Let me just give you kind of what we're trying to accomplish here, and that is, we want to come up with what we're calling a test group opportunity. And what that really means is, here are the goals. The goals are, we have two great organizations, Select Health and Stonehill, and really what we're trying to do is close the gap on under 65 and over 65. And Corey's done a great job of showing us some of the nuance as to why that's not as easy as we all think it should be. And maybe one day, hopefully it will be. But really how we get to that is a combination of Select Health's involvement, our involvement, your involvement as an agent, and to some smaller degree, the client's involvement. And we do that through reporting, through analytics, through relationships. But that's the first goal, is to help close this gap, right? That's what we've been talking about. And the second two goals really are to help the over 65 agent population get involved in under 65 in some way, or the under 65 agent involved in over 65. And that is because marketing opportunities on both ends and the growth opportunities of the future lie within both of those realms. And so what we're trying to do is bring a test group together of good, like-minded agents. Some of you on the call do both. You do commercial or group business. You do under 65 and you do over 65. Others of you listening and participating only do the one. And we recognize that, right? Stonehill we wear all those hats. And so we feel uniquely qualified to actually help all of our agents, whether you focus on under 65 or over, and with a great partner with Select Health to actually bridge those gaps. Because additional compensation in the future is important, and adding stickiness with a client or with a relationship is important. And so we think that doing this with Select Health and being transparent all across the board is going to not only help us individually as our own producers, but also with Stonehill and Select Health to actually do some of these things, that the feedback mechanism is going to initiate change. And then the fourth and final thing we're trying to do is then to take what we've learned in this test group opportunity environment and then automate the possibilities. And that's where the magic will happen at some point, right? And we think if we do things right, the automation of that is going to be likely. And let me just expand on one point that Corey made earlier. So right now, network and RX are the two big differentiators between under 65 plan, a commercial plan, and an over 65 plan. On the network side, Corey told us and did a great job of letting us know commercial usually has a contracted rate associated with it. Medicare doesn't. Medicare operates off of a percentage of Medicare. But there's new plans coming in and being developed, and some would say some of the new level or self-funded plans of the future are going to operate off what's called RVP, which means reference-based pricing. The reference base that they're talking about is a percentage of Medicare. Well, that's the exact same network, if you will, that Medicare operates off of. So from a Stonehill side, we're working with a lot of different people and are involved in a lot of different fronts to see how RVP is going to play out. But I can tell you already, RVP was never really good in the state of Utah, Idaho. It was pretty good in Nevada. But just in the last 2 years, this reference-based pricing plan is now covering 95 to 98% of all commercial type of products given within a group environment. And what that means is that this gap that we are kind of struggling to kind of close is going to start closing. And it's going to start closing whether we like it or not, but it's going to be amplified, and we want to put you on the leading edge of this type of thing. And that's why we're so thrilled to have the cooperation of Select Health. Hopefully you find a lot of value with Stonehill, because those of you that understand all these things and how they actually start to unfold are going to be in a much better position to either get involved in one of the other under 65 or over 65, or hopefully have the skill set and tools that we can help provide you to start partnering with people like PNC firms or financial planners or just traditional group agents or agencies, and come in with a really good knowledge of why those things matter and how this gap is starting to close. So to Grayson's point, if you're interested in kind of being part of this test group, just let Doug know. We're putting together, I've already talked to a bunch of traditional group plan people that don't do Medicare. My goal is to get some of you affiliated with those agents and agencies so you can be their Medicare person per se. But I also know some of you kind of do both, and we'd like to make sure that we have some of you in this test group as well, because I'm sure there's information that we could glean and learn from you as well. So does that kind of give you a sense of what we're trying to accomplish from Grayson's standpoint, and maybe a little bit of maybe what's in the future as far as kind of closing that gap that we're all trying to understand better?
Colette had a question in the chat. No, there's not necessarily compliance rules, other than if somebody is referring you out to a small group or Medicare, they're the ones who create the contact, or you might need a permission to contact depending on how they want to send that out. Colette, does that make sense? I'll wait to hear from you. If you need to reach out and ask additional questions, let me know. It really has to do with the permission to contact. So if they create that soft lead and the member's reaching out to you or the group is reaching out to you, you actually can reach out to a small employer group or an individual, mid-size or large. It's just the Medicare, you have to have permission to contact or that soft introduction and allow the Medicare member to reach out to you. So just make sure you're following those compliance rules. Yes, professional groups can receive a referral fee. Anyone can.
Yeah, and that's mandated by, the federal government, right? So
Those, yep, referral fees are allowed for CMS.
Yep, those rules are kind of defined for us. It kind of makes it easy.
I'll give you an example, actually, even Lori. So I've got a PNC agency in Idaho that expanded into Medicare. And so they ran an entire campaign within their agency and gave a $50 gift card to anyone that referred to them and actually enrolled. So it was their way to kind of cross-sell within their own book of business as they decided to get in the Medicare game. They were PNC, a large ACA book of business, small employer, but they were referring all of their Medicare business outside of their own agency. And so when we were able to sit down and actually kind of talk them through the financials of what they were missing out on and how they could continue to support that membership, right? From, I hate to say birth to death, but it's true, birth to death. How can I support my membership all the way through as an agency or an agent? So when we talk through the financials and some of the ways that they could actually bring that business in-house and serve those communities, it was a no-brainer. We got 4 brokers licensed for Medicare, got them trained up, and they started this referral fee program. And they worked really well. Attorneys. So yeah, you could partner with attorneys. Yep.
Yeah, one thing I've seen, just so you're aware, is some PNC companies do not allow compensation from any products that the PNC company doesn't represent. So sometimes you'll have to be aware that maybe, Joe agent from a certain PNC firm says, well, I can't receive compensation from that. Well, technically, this is a referral fee. So you'll just have to work those things out with that agent or agency because it is not a percentage of commission at all.
And the ones that are going to be easiest to work with along that line are going to be, there's a captive agent and independent agency. Captive are going to be like the American Family. My mind just went blank now that I'm American Family, Allstate, State Farm. The ones that are independent are the ones that sell multiple. Obviously, everybody knows this, but so the independent groups are going to be the easier ones to work with. But there's a lot of both. I mean, it does no harm to get in with a captive, but I think the independent have more of a freedom. They don't necessarily have someone that they report to in that world.
And the people who are on this phone call, you've expressed interest. So we are going to be looking at you at the very beginning of this process to see if we can incorporate you in, just because you have supported us here.
Is this interesting? Is it helpful? Do you think,
Yes.
there are possibilities or opportunities here? And what other ideas might you have that we could actually incorporate into this test group opportunity?
Yes, I like it. Anything that, give me the opportunity to meet with more people and so forth is great. I like the idea. Yes.
Okay. Well, it looks like I'm just reading what Colette said. Okay. Thanks, Colette. It looks like we have exhausted what we have to talk about today, though we're very grateful that Corey and Grayson and Kirk were able to join us and to explain this program. We think that things are changing out there. We think that instead of being able to talk to beneficiaries who are thinking about getting enrolled into Medicare, when they are T65 minus 3 months or T65 minus 6 months or 10 months, the way that you're all accustomed to doing, we think now that you need to start thinking about talking to them at T65 minus 36 months, minus 48 months, maybe even minus 60 months. And if you can get them to have a sense of trust in you and believe that you know what you're talking about and that you've led them along and that you've emotionally prepared them for Medicare, I think they're going to be there. Because most people, I'm just going to remind you of something that I've said several times. But there were surveys that were done, and I think it was by the Kaiser Family Foundation, and they found that people enrolling in Medicare or needing to enroll in Medicare or feeling obligated to enroll in Medicare, and they didn't just not at T65, but also during the annual enrollment period, would prefer to have a root canal or a colonoscopy to dealing with Medicare. So if you can actually start with these people at 60 months or 48 months before they're going to be having to enroll in Medicare, and you can reduce that level of stress, I think that you're going to be able to reap the benefits. So contact us. I know that a couple of you have already sent me text messages about this program. We are going to be trying to flesh it out. We're going to be trying to figure out which of the group producing agents need help, which are what the best way to do it is, to figure out how we can facilitate that. But we will be rolling this out. It may take us several weeks, but we're going to move forward on this, and we look forward to doing that. We are recording this. We recorded last week as well, and I'd just like to remind you where that is located. You can go out to a website called MedicarePlanDetails.com. It is behind a very easy password. That password is MA 2023, lowercase MA, so MA 2023. You get in there, there is a folder that's called something like videos about the industry or something like that. So you can go in there, you can click on it. These videos are high definition. They don't download to your computer. You just play it right there on a viewer that's on your screen. And we're going to have, so we've got last week's already posted out there, and we're going to have this week's posted out there as quickly as we can. It takes Google a little while to render this, and then it takes us a little while to render it out there. So we probably won't have that till Monday afternoon for today's episode, but it will be out there. And we'll start taking, we're going to take notes about who's interested, and we'll be reaching out to you. And I believe that's all that I have today. So thank you again, everybody, for all your participation. And I'll stick around here if you do have questions, and we'll see you next time. Thank you.
Thanks for having us. We appreciate you guys. Have a great weekend.
Thanks, everybody.
Thank
Thank
you.
you.
Yeah.